there. This week in week 2 we're going to look at 2 events from our recent history of healthcare here in New Zealand. Now they're both sensitive cases. You may have known people that were involved in them. I think they are important stories to tell because as retelling them sort of honours the people that were involved and recognises the sort of sacrifices that were made. The first case is referred to as the Cartwright Inquiry, and it tells the story of Professor Green, who was an obstetrics and gynecological consultant at National Women's Hospital, and he had a hunch about cervical cancer, and so as a scientist he put his hunch into practice, but however it wasn't done in an ethical way. So he had women that he was treating for early stages of cervical cancer, and he conducted what many describe as an experiment of sorts, because he withheld treatment from part of the group. Whilst that sounds scientific, it was very unethical because he didn't inform the women of what was going on, and as a result many were emotionally, psychologically, physically harmed, and some women did die. The positive side of the Cartwright Inquiry, coming from the unfortunate experiment, was that it led to a review, Royal Commission of Inquiry, and also the implementation of the Health and Disability Patients Code of Rights. The second example we look at looks at chest physiotherapy for neonates, again at National Women's Hospital. And this was the actions of the chief physiotherapist who travelled overseas and observed a new way of performing therapy on very premature babies, came home to New Zealand and put that into practice, trained other people to also enact this therapy. But the way that it was administered, its duration, its intensity, was not sort of monitored in any way, and again children died as a result. So these cases are real triggers for us to think about how do we act with integrity, whether we're making the decisions ourselves, as was the case of Professor Green or the physio, or whether we are the new graduate witnessing unethical practices, giving us confidence to speak up when we feel things are not right.